clinical example, we have the balancing on the organ clock. A patient had constipation with the very dry rabbit stools and was troubled by a colicky pains and bloating, but with not enough stool to follow. This had caused an anal fissure, which much pain during defecation. She also passed very little and concentrated dark urine, and her skin was generally dry all over. This is a case where the kidney has a yin deficiency, as there is less water in the entire body. And the large intestine, though is also dry, has an excess of yang. As the excess in the large intestine is in its own polarity, and the deficiency in the kidney is again in its own energy, we could use the organ clock to balance both with just 1 point. Technically, this 1 point could either be kidney 10 to be tonified, or we could sedate point large intestine 1. The tonification of kidney 10 is preferred. If the organs on both sides of the clock are in balance, tonification of the deficient 1 is better. But if only one side is excess or deficient, then that organ can be either tonified or sedated accordingly, and the healthy side is not treated. Kidney 10 will tonify the kidney yin, which will improve the dryness in all the body, including the stool. As the energy will have to come from the large intestine, this will reduce the large intestine yang, thus reducing the inflammation and pain around the anus. So sa treatment, we have the local points for the abdomen, symptomatic points for constipation, large intestine 4, stomach 25, and triple warmer 6. Influential point for young organs, we use REN 12. Energy balancing point, kidney 10. Advise the patient to drink more water and include some salt in her diet. Some white rice or fruit will also help to soften the stool. Now we go to the clinical example 2, balancing on the organ clock, female, 34 years old. A migraine sufferer comes to you with a history of recurrent one-sided headache since many years. The headaches are very severe, pulsating with vomiting. She also suffers from insomnia and has noticed the headaches to appear on nights when the insomnia is particularly bad. She is pale, pleasantly talkative, very restless person, anxious, and easily stressed at work. This has resulted in many sleepless nights and migraines. This is another ideal case for using the organ clock. On the one hand, the patient has less heart yin from the years of poor sleep and anxiety and restlessness, with also blood deficiency from the paleness. On the other hand, she has the migraine, headache, which are one-sided, which is the gallbladder meridian, and are very young in character when they occur. So we have a situation of simultaneous heart yin deficiency and gallbladder yang excess. We can balance this with either point heart 8 to be tonified, or by sedating point gallbladder 41, which is both horary points. The complete therapy would be as follows. First, we have few local points for the headache. Point large intestine 4 as a distal point for the area of the head and face. Symptomatic point for the headache, GB20. Symptomatic point for vomiting, PC6. Influential point for muscles and tendons, GB34 for the tension. Influential point for blood vessels, lung 9. Pulsating headache, and energy balancing point, heart 8.